1. When training new evaluators to administer the wppsi, which instructional method best aligns with adult learning principles that emphasize practical application? A. Delivering a lecture on test history without demonstrations. B. Providing hands-on practice sessions with real materials. C. Assigning only reading of the wppsi manual. D. Showing a video of test administration without feedback. 2. An experienced mentor observes a trainee consistently scoring wppsi subtests incorrectly. According to effective mentoring techniques, the first step should be to A. Reassign the trainee to a different task. B. Provide corrective feedback with specific examples. C. Wait until the final evaluation to address errors. D. Reduce the number of subtests the trainee administers. 3. In curriculum development for wppsi administration training, the most effective sequence of content delivery would be to E. Teach advanced scoring rules before basic test structure. B. Begin with test purpose and administration principles, then scoring. C. Start with data interpretation, then administration protocols. D. Only focus on practice without any theory. 4. A supervisor must ensure regulatory compliance when storing wppsi test protocols. Which action is most appropriate? A. Keep protocols in a locked cabinet with limited staff access. B. Store protocols in a shared office drawer for convenience. C. Allow test takers to take protocols home for review. D. Digitize protocols without encryption. 5. During a training session, an adult learner administering the wppsi asks why certain test items must be read verbatim. The best trainer response, using adult learning principles, would be to A. Tell them to follow the rules without explanation. B. Explain how standardization impacts validity and reliability. C. Suggest they reword items for better rapport. D. Ask them to research the answer on their own time. 6. An evaluator notices a child becomes distracted during a wppsi subtest. According to wppsi administration protocols, the correct approach is to A. Skip the rest of the subtest and score based on completed items. B. Pause briefly and attempt to re-engage the child. C. Provide hints to maintain the child's focus. D. Continue testing without addressing distraction. 7. When mentoring a colleague new to wppsi interpretation, the most effective feedback method is to A. Provide immediate, specific examples tied to scoring criteria. B. Wait until the colleague completes multiple cases before feedback. C. Only provide feedback when major errors occur. D. Offer generalized comments without reference to criteria. 8. In developing a wppsi training program for adult learners, incorporating self-assessment activities primarily benefits trainees by A. Allowing them to passively absorb content. B. Encouraging reflection and identification of personal learning gaps. C. Reducing the need for formal evaluations. D. Eliminating the need for instructor feedback. 9. While observing a trainee, a mentor notes inconsistent application of wppsi scoring rules. The most effective instructional intervention is to A. Assign them additional independent study time. B. Demonstrate correct scoring, then supervise immediate practice. C. Wait until the end of the week to review scoring errors. D. Provide them with the wppsi manual without further discussion. 10. To ensure ethical compliance in wppsi administration, test administrators must A. Modify test items to fit the child's cultural background. B. Administer the test only to children within the standardized age range. C. Share test results with all school staff members. D. Use non-standard prompts for anxious children. 11. In wppsi training, adult learners are most likely to retain knowledge when A. They are given real-life case studies to apply concepts. B. Information is presented solely through long lectures. C. Trainers focus on rote memorization of the manual. D. They receive no opportunities for hands-on practice. 12. A training program includes role-playing wppsi test administration. This technique primarily supports A. Theoretical understanding of intelligence testing. B. Passive absorption of test content. C. Skill acquisition through experiential learning. D. Reduction of test security risks. 13. A mentor wants to encourage reflective practice in a new wppsi examiner. The best approach is to ask them to keep a log analyzing each administration experience. B. Limit feedback to pass-fail judgments. C. Provide a checklist without discussion. Avoid discussing past performances to keep morale high. 14. A wppsi administrator modifies standardized instructions to simplify wording for a child. This decision A. Maintains the integrity of the test results. B. Violates standardization requirements. C. Is recommended for all young children. D. Is permissible only if approved by the parent. 15. In creating assessment rubrics for wppsi administration training, the most effective design will A. Focus only on the final test scores achieved. B. Include observable, measurable criteria for each skill. C. Use vague descriptors to allow flexibility. D. Be based solely on self-reported confidence. 16. An adult learner resists using the wppsi scoring software, preferring manual scoring. An effective trainer response would be to A. Enforce software use without explanation. B. Explain efficiency and accuracy benefits, then provide guided practice. C. Allow them to continue manual scoring indefinitely. D. Remove them from the scoring task. 17. During a wppsi workshop, the trainer uses real anonymized protocols for scoring practice. This primarily addresses A. Regulatory compliance and confidentiality. B. Ethical training without compromising child privacy. C. Curriculum development for scoring accuracy. D. All of the above. 18. A supervisor developing a wppsi training module for adult learners should ensure that A. Content is lecture-only to maximize time efficiency. B. The module addresses both theory and practice. C. Trainees memorize the manual word for word. D. The training excludes hands-on activities. 19. A wppsi evaluator in training misplaces a completed protocol. According to compliance guidelines, the mentor should A. Treat it as a breach and document the incident. B. Ignore it if no one notices. C. Recreate the protocol from memory. D. Allow the trainee to continue without corrective action. 20. When coaching a wppsi examiner on building rapport with children, the most appropriate advice is to A. Allow excessive time for off-topic conversation. B. Engage warmly while maintaining standardized procedures. C. Offer tangible rewards for correct answers. D. Skip rapport building to save time. 21. A wppsi administrator is training a new examiner and notices the trainee improvises instructions during subtests. Which mentoring strategy best ensures adherence to standardized protocols? A. Provide a checklist and observe until correct administration is consistent. B. Ignore deviations if they don't seem to affect rapport. C. Allow personal style to override standardized wording. D. Reduce the number of subtests the trainee performs. 22. In adult learning-focused wppsi training, using real-world case scenarios primarily helps by A. Encouraging rote memorization of manual content. B. Linking theory to practice for better retention. C. Reducing the need for practice sessions. D. Limiting exposure to complex cases. 23. A mentor reviews a trainee's wppsi scoring and finds systematic underscoring on verbal tasks. The best instructional intervention is to A. Provide a targeted review of verbal scoring rules with examples. B. Have the trainee retake the wppsi manual quiz. C. Assign unrelated administrative tasks. D. Ignore errors unless they affect final composite scores. 24. Which action best meets regulatory compliance standards for protecting wppsi testing materials? A. Storing all unused test booklets in a locked, access-controlled location. B. Keeping protocols in an unlocked staff lounge cabinet. C. Allowing families to photograph the test for reference. D. Sharing test items with teachers for practice drills. 25. In wppsi workshops, encouraging peer-to-peer practice among adult learners benefits skill development by A. Allowing learners to passively watch demonstrations. B. Providing immediate feedback from multiple perspectives. C. Reducing the need for trainer involvement. D. Eliminating formal assessment requirements. wppsi, Wechsler Preschool and Primary Scale of Intelligence. The Wechsler Preschool and Primary Scale of Intelligence, wppsi, is a standardized assessment designed to measure the cognitive abilities of young children, typically between the ages of 2 years 6 months and 7 years 7 months. Developed by Dr. David Wechsler, the wppsi evaluates a range of intellectual functions, including verbal comprehension, visual spatial skills, fluid reasoning, working memory, and processing speed. It is widely used by psychologists, educators, and clinicians to identify developmental strengths and weaknesses, guide educational planning, and assist in diagnosing learning or developmental disorders. Administered individually, the wppsi uses engaging, age-appropriate tasks to ensure accurate results while keeping children motivated and comfortable during testing. Here are the top 5 beneficial uses wppsi, Wechsler Preschool and Primary Scale of Intelligence, exam. 1. Early identification of developmental delays. The wppsi helps detect cognitive, language, and processing weaknesses in young children, enabling timely interventions and support. 2. Guiding educational planning. Results provide educators and specialists with detailed profiles of a child's strengths and areas for growth, informing individualized learning strategies and placement decisions. 3. Supporting diagnostic assessments. The test assists psychologists in diagnosing intellectual disabilities, giftedness, and neurodevelopmental conditions such as ADHD or autism spectrum disorder, ensuring accurate treatment and educational recommendations. 4. Monitoring progress over time. wppsi scores can be compared across different testing periods to evaluate the effectiveness of interventions and developmental growth. 5. Research and program development. Data from wppsi assessments contribute to studies on child development and help create evidence-based educational and clinical programs.